I am here with Rob Marty today. We'll edit that out. I'm here with Rob Marty, who is an experienced healthcare administrator, corporate wellness strategist, and community engagement professional. Rob and I are going to talk all about health equity and the intersection between health equity and workplace diversity, equity, and inclusion. Just a little bit about Rob. He's the Chief Operations Officer at Case Specific Nutrition, where he's the primary contact for corporate wellness planning, nonprofit community planning, and strategic initiatives. He's also getting his Doctorate of Business in Healthcare Administration through Liberty University. And he is a passionate advocate for underserved communities, particularly people with intellectual and developmental disabilities. Rob, we're super thrilled to have you today. Welcome to Better Humans at Work.
Oh, Dr. V, thank you for having me. I'm very excited to be here. We've been talking about it, so to see it come to reality is exciting.
Yes, it's wonderful. And Rob's here in the Pittsburgh area. Rob and I met at a Chamber of Commerce meeting, and little did we know, I think that was one of the last things I did in person before the COVID pandemic took over all of our lives.
It has been amazing to me how many people I have met and been able to stay in contact with following COVID, thanks to virtual and how we've been able to connect through Zoom and create these platforms for engagement. It's been one of the bright lights.
Yes, silver lining for sure. So Rob, I'm super thrilled to finally have you on the show to talk about all things health equity. As I mentioned, Rob's getting his Doctorate of Business in Healthcare Administration, and you've been in the nutrition and health space as a professional for a while now. So how did you get started in this field?
Yeah, that is a fantastic question and something that I really enjoy kind of talking through, because I think that our experiences is what gives us value when having these conversations. Is you have to look at personal experiences and where people are coming from to understand where we're going. Yeah. So I was raised on a dairy farm in Wayne County, Ohio, which is an hour south of Cleveland. It's 2 hours here from Pittsburgh, and milked 330 black and white Holstein cows every day to pay for my bachelor's. I went to Slippery Rock University originally thinking I was going to get my doctorate in physical therapy because I played football and was very, very bad and got hurt. And my physical therapist in high school went to Slippery Rock, so I went to Slippery Rock. And while I was there, their undergrad program kind of remolded my path, my trajectory. And I realized that PT is phenomenal. Physical therapy is phenomenal. It serves a huge purpose, but it is reactive. And when we think about healthcare and wellness and nutrition, mindfulness, we realize that it should be proactive. We should be enabling our communities, our workforce as employers, especially our workforce. We should be using wellness initiatives to prevent as many of the PT-related needs as possible through lifestyle. And so I ended up getting my bachelor's and going right into the workforce. And since then have worked either in corporate wellness or in healthcare. And DEI really kind of hit me in the chest like a ton of bricks when I was hired to do corporate wellness for a home care provider in Ohio who offered services to individuals with intellectual and developmental disabilities. So this employer had 1,300 employees and provided home care, residential, day service, transportation services for adults and children with IDD, intellectual and developmental disabilities. And every time I have a DEI conversation, I can plug and play from that experience, because your workforce, very rural based. We're talking Ohio here, state of cornfields, and they were making minimum wage. And they were working with folks who had been failed largely by the system, institutional care. They were coming from a place where maybe family wasn't involved. Most of their support was paid providers. And that was very challenging work. So to make minimum wage and to be in such an empathy-driven, challenging job, how did you engage that workforce? How did you make sure that they felt supported in everything that they were doing? And then on the opposite end of that spectrum, our clients, the folks we supported, I had practitioners, doctors who would tell us that we don't serve that kind of person. We don't provide care to somebody with Down syndrome who has an intellectual delay because their status of life is what it is, and it's hard to communicate. We don't know how to bridge that gap and to make sure that we can support them. And that is so discouraging, because when you look at, I'm going to unplug this because it's beeping. When you look at that, that was my first introduction to the lack of health equity. And it made me realize that I really feel called to advocate for healthcare reform. And at that time, it was solely focused on individuals with intellectual and developmental disabilities. But then everything with George Floyd happened. And I realized that here I was extremely passionate about inclusion, diversity, and I wasn't having these conversations with either my workforce or my friends and family members who are Black, Latino, or represented in a minority group, and how healthcare has failed them.
Yeah.
And so I began having those conversations with friends first, right? Just pulling your network to ask the question, what am I missing? What do you want me to know as a white privileged male who has not faced any form of racism or prejudice in my entire career? I was very, very young when I ran the home care in Ohio, and I accredit that opportunity to the fact that I was a white male. I had 40, 50, 60-year-old nurses who listened to me because of what it means to be a man in the workforce. And I realized that. And now I am the chief operating officer for Case Specific Nutrition. And it's still a very relevant conversation in this field, because something like 80% of all dietitians are white females. And our mission is to provide accessible nutrition services for our community. And that means our food vulnerable, low income Medicaid community members who have different food preferences and cultural recipes and ethnic food considerations that they want included. And we need to be mindful of that. And a white female might not be the best person to be mindful of that. So you need to have a workforce that can meet people where they're at. And that means extending outside of ourselves to look at our hiring practices and saying, how are we involved with our school system and making this an accessible career? So that was a very long-winded response. But
no, there's so many different pieces in there. And, Jennifer Brown always talks about, like, what's your diversity story? Because we all have that, right? And I just did a inclusive leadership training earlier today with a client, talking about, like, yes, like calling out, there's a lot of white men on this call, but y'all are still part of this diversity picture and where you come and your experiences, even though there's definitely privilege in there, right? I have a lot of privilege as a white person. I similarly started my journey with a very targeted slice of DEI. So looking at gender equity and how allyship, how men can be allies for women in the workplace, and also then grown to take a more intersectional approach to that. So it sounds like we have lots of similarities in our diversity journeys. You did mention health equity a few times in there, and I would love for you to define that for our audiences. I know there's the tired picture of the people sitting on boxes, looking over the fence at the baseball game. So let's put that picture aside. Tell us in your words, Rob, what is health equity?
Oh my goodness. When I think of the primary bucket of our DEI efforts, I know that from an HR perspective, we're looking at fair hiring practices, fair wages, fair pay. And that's because that's what's front and center. That's what a lot of data is being looked at. And from an employer standpoint, that feels like what you're in control of. Health equity is no different than looking at fair pay and fair hiring practices. It's making sure that the job, healthcare, being your annual wellness visit, access to a dietitian or an eye doctor, your preventative care, is as easy to access for the Black man as the white man, as the Latino female. It's equitable. It's equal across all playing fields, regardless of location. There's a lot of research when we're looking at health equity and healthcare. You're looking at rural communities and the number of primary care physicians that are available in a 100 square mile radius, and how in rural communities you might have, one primary care physician practice or something like that, whereas when you're in a city, you have hundreds. So how do you address that based off your workforce? Do you have manufacturing plants that are in the middle of nowhere? Well, you need to look at bringing in maybe physicians on the ground to be available within your office to perform, your annual checkup or have blood pressure checks and things of that nature. You need to meet people where they're at. You need to make sure that it's accessible to everybody. The irony is that we pay 8 to 12% more every single year as employers for our health insurance. That's a huge cost. It's a huge thing that affects our ability to give employees raises and do the things that we want to do. But I think a lot of us, because our bandwidth is so stretched and we're hyper focused on fair hiring practices, that we're not extending the power that we have and the leverage that we have as the employer who's paying so much money for these medical benefits to say, we want telehealth. Mm-hmm. We want to know where and whom of our employees are not utilizing annual wellness visits. And we want you to help us provide targeted health literacy, health education to them, because it's not that people don't want to use wellness services and healthcare. It's that they reflect their experience, their environment. And if you weren't raised having your twice annual teeth cleaning and your annual eye visit and your annual physical exam, then you aren't going to start out of the blue, right? And the employer's paying for it. Tens of, not hundreds of thousands of dollars every year. Use that leverage to say, accessibility to us matters. And the funny thing is you don't have to target, your minority groups within your workforce. If you look at utilization, the research has shown that the people not using it are going to be your minority groups more than likely. And so by just addressing where utilization varies, you're supporting DEI efforts.
Oh, there's so many amazing nuggets in there. Okay, so first off, I wanted to call out something I thought was so brilliant that another health equity expert here in Pittsburgh was chatting with me about the other day, Jessica Brooks. I'm going to tag you in this, Jessica.
Yeah.
Phenomenal. But I was asking her, where do I even advise my clients to get started with health equity? And I loved your example, Rob, about, just telehealth. Like, how do we get,
right.
more access, right? And something that you said that Jessica also said was by looking at the data and seeing who is underutilizing all these healthcare services. And by solving that problem, that is targeted at, fixing that particular subgroup, but we're all going to benefit from that. I would love to have a one-pager hanging up on my desk of like, okay, I need to have 2, dental checkups a year, one of this, one that, get my blood pressure. That would be so helpful for me. And I probably have higher usage, right? But I love that, like, fixing problems for certain groups helps all groups, right? All, like, the tide rises.
Everybody rises.
Everyone rises. But another interesting thing I wanted to call that Jessica said was, we pay all that money that you mentioned, and why not put that solution creation back on the vendors, back on the providers? Like, hey, I want to see this data, and I want you to come to me with solutions and ideas on how to fix it, right? Like, we don't need to be internal health equity experts. We can be internal DEI experts or HR professionals, but we don't have to solve.
We have to be the advocate.
Exactly.
The big players in healthcare are not going to proactively do this because there's not money behind it, right? But that doesn't mean they won't. It doesn't mean they won't. They need to hear from us, and they need to know that it's a priority. That's how change occurs, is when people stand up and they say, this is no longer acceptable. I have employees that are in, communities where they don't have access to primary care conveniently. What are you doing about that, medical provider? Because you're the one who's supposed to make this accessible. Is it that you're going to provide community-based pop-ups and go out to the community once a month with a van and do blood pressure checks and, cholesterol checks and things of that nature. What are you going to do to address this? Because that's what we're paying you for. And it's really important to us. And if you won't do it, we'll switch providers.
Exactly. So capitalism at times can help with DEI.
Yes, of course it can. Yes.
And so we've talked about the intersection between DEI and health equity, and you're getting a little bit about, the advocacy, but I'm also curious to hear more about, what type of barriers, like our best practices, barriers to remove to increase health equity at organizations.
Yeah, absolutely. I will address that really quickly. I want to say Jessica Brooks is with the Pittsburgh Business Group on Health, and that group is phenomenal. We're also involved in it. I love what they do. I love what they're bringing from an advocacy standpoint, how they're bringing vendors together. So that is a great group to connect with, either as a individual who's looking for networking opportunities or for your business. I know that they have various levels of plans. Mm-hmm. And then before we jumped on today, I was watching some of your previous interviews, and something that I wanted to just make sure I put up and reiterated was your interview with Dr. Paul Spradley, when he was talking about how it would be extremely uncomfortable for him as a Black professional to call somebody out on white fragility. And that's where I can thrive as a fragile white male, because I can call that out and it's going to be better received. That is our role in this, is using the relationships that we have when we are one of 90% of white professionals in a room. It is our place to call that out. Do not put that on your colleagues.
Yes.
Because certainly it would be uncomfortable.
Well, and
it's not going to be it's not going to be received the same way.
And research has proven that. There's a study from business professors out of CU Boulder that found that those who advocate for DEI outcomes, whether health equity or, fair hiring or whatever the DEI outcomes are, if that person is a white male, it's better received, right? Because they're not viewed as being self-serving by that, which is super important to know, but also kind of heartbreaking, considering there are so many women and people of color and those from underrepresented groups in the DEI space. So we have this disadvantage, right, by identifying as one of the group, but we also have the lived experience. So it's like, how do you balance that? And the point that you're making, you're talking about allyship, Rob, which is my favorite topic, near and dear to my heart, like leveraging your power and status to advocate for people who aren't in the room or who are different than you in some substantial way. And I love that example of just like, how can we leverage our privilege? Privilege is such a bad word, right? People get so offended, but I think privilege is really powerful. If used for good, right? Why can't we change this conversation and use our privilege for good, and advocating for health equity would be a great way to do that. And so I know we like to end these conversations, Rob, with some pointers. So for those out there who want to learn more about fostering more health equity at their organization, what would be some recommendations you have for the viewers out there?
Really quickly, I want to say this because I don't get many platforms that get to disseminate information. Within the intellectual and developmental community, the NVR word is a huge initiative. And so you never realize just how often people use the word retarded. It's completely inappropriate. And so my family, friends, anybody who's interacted with me who's ever said it, I just say, we don't say that. So I would challenge anybody who's listening that if somebody around you says it, just say, we don't say that.
We don't say that.
It might be the last time they say it around you, because we know that it's inappropriate. But if nobody's ever called you on it, you don't. It's the allyship. You point it out once, and most people do want to do well and be inclusive, and they're just not thinking in that way. And then to answer your question on what is my tip, communication is the solution to all things. You have to create forums for communication. Psychological safety is the flash term, creating an environment where people will say things that they perceive as uncomfortable. It's the employee who is considering transitioning jobs. Creating a psychologically safe workforce means that they come to you and say, what can you do for me? This is what I need. In DEI and with health equity, it's HR realizing the power that they have it's HR saying, I am going to pass this responsibility, as Jessica Brooks said. I'm going to pass this back to the vendors. They're making the money on this. They are responsible for disseminating the care and making sure that communities are supported. So I'm going to tell them that I'm not satisfied with what's being offered, because I am an inclusive workforce and I want to make sure that all of my employees, spouses, and their dependents have access to primary care, mental health services, nutrition services in a way that meets them where they're at, regardless of public transportation, pay, salary, or previous experience with healthcare. Just have the conversation. And you can never beat a good thought group, creating a board. Your employees want to be involved. From a nutrition and a wellness standpoint, we call them our wellness warriors. Get representatives from your workforce who want to have these conversations and let them pour their energy, their passion, their experience into it, and lead the conversation with your medical provider or your wellness program or whatever that looks like. You don't have to burden yourself with trying to juggle all these different tasks and being the sole advocate. Let people help because they want to.
I love that so much. I'm all about the warriors, whether you're a healthcare warrior, a
Right.
gender equity warrior, an anti-racism warrior. So I love that. Anyone who is passionate about this area, I encourage you to take Rob's advice to heart, be that health equity warrior. And if nothing else, if you are an HR professional, start challenging those who are providing these services, and, vote with money is powerful, right? Vote with your feet. And so, Rob, I have your LinkedIn up on the screen. How else should and can people get in touch with you?
We want to hear from anybody who's listening, who's passionate about these things, whether it be from a health equity standpoint or a nutrition standpoint. CaseSpecificNutrition.com is the sole, it's the best place to go if you're looking for nutrition services or introducing wellness programming as an employer. Something that we continue to offer is any group we haven't worked with, we will offer a free virtual health huddle, and that can be on mindfulness, progressive relaxation, diabetes, chronic disease. And the reason we do that is because we know that budgets are strained and nutrition falls very low, health equity falls very low on the priority list. So let us just come in and provide this to your workforce. You can record it and put it up on your website so that employees on third shift, making it accessible to your entire workforce means recording it, making it available to those who can't attend. And then that provides an opportunity for them to hear that it might be available through their health insurance. So full circle back to message. I love having virtual coffees and connecting with people. I think anybody listening to this is obviously somebody who shares in you and I's vision for reform and change and allyship. So you're somebody that I would love to talk to, and I hope you send me a message.
I love it. Well, thank you so much for sharing your expertise, everything you're learning through your practice and through your studies, Rob. And I'm so grateful for all you're doing, especially in the health equity space, to help us all be better humans at work.
I love that.
Thank you so much for joining us today. Have a great day, everyone.
Bye, everybody.